Hannah Skinner, thanks for
Hi.
joining us today. So what we're trying to do is introduce you, the audience, to some of the other people that work here at Senior Savings Network. There are a lot of smart, brilliant people. And if you look at our Google reviews, you'll see that Hannah is mentioned quite a few times because people enjoy working with her. So today we pinned her down, yanked her out of the room where she has an office, and we're going to ask some questions that you might want the answers to as well. Hannah, what are special needs plans in Medicare Advantage?
Special needs plans. So those are actually Medicare Advantage plans. When you hear special needs plan, just know that you are on a Medicare Advantage plan. However, it might be a good plan for you. When we're talking about special needs plans, really we're talking about chronic illnesses. You might need extra care for those chronic illnesses, or you might need extra assistance with your Medicaid. If you're on Medicaid, you might have a special needs plan. So it's going to give you, maybe if you have Medicaid, lower copays, extra benefits, dental, vision, hearing, things that you wouldn't get with a normal Medicare Advantage plan. For the chronic illness plans that are also special needs plans, let's say you have a heart disease, it's going to give you better access to those doctors. It's going to give you lower copays maybe on your specialist. If you've got diabetes, maybe you'll get lower copays on your diabetes medications and supplies. So they can actually be really helpful if you have any of those qualifying conditions.
Now, these questions actually came from you asking us questions online. So the next one here, why do doctors not like Medicare Advantage plans?
So doctors don't necessarily like Advantage plans. There's two main reasons why: denials and prior authorizations. So prior authorizations, the doctors are having to, instead of doing their job, which is taking care of you, they're having to be doing a lot of clerical work and appealing your claims for you and going in and saying, this is why this needs to be done, instead of actually doing it. The other reason is denials, and they're just simply not getting paid. If they deny your claim and you can't pay it, then nobody pays it, and the doctors need to get paid too.
Yeah, the president of the American Medical Association said last year that doctors are spending more than 20 hours a week on clerical things, and that is all prior authorization, trying to justify why you need the care that you need. So what's different on a Medicare Supplement plan?
On a Medicare Supplement plan, it is actually secondary to traditional Medicare. And with traditional Medicare, they're going to cover it if it's medically necessary. Your doctor doesn't need to do any type of prior authorization. If they say that you need it, it's going to be covered. And your Medigap plan has to cover anything that the Medicare, traditional Medicare does.
Yeah, and that's quite a big difference.
Huge difference.
Can I switch from a Medicare Advantage plan to a supplemental Medigap plan during the annual enrollment period without answering any health questions?
Unfortunately, no. There are some states where you can, but for the majority, no, you are going to have to answer health questions unless you're in your initial election period, which is when you're first going on to Medicare. Definitely reach out to an agent. You can find our number below, but there might be a plan that you think you're not eligible for that you're eligible for, so it's always good to try. But yeah, you do have to answer health questions.
And it's important to note that this question was specific to the annual enrollment period, which is October 15th through December 7th, but we have another period that they could also make this type of switch. And what is that?
That is Medicare Advantage open enrollment period. So if you are currently on a Medicare Advantage plan, during this time you can either switch to another Medicare Advantage plan or to a prescription drug plan. So if you think that you missed your shot, you do have 3 more months coming up, January 1st through March 31st. You can make one additional change. So that change will stick for the end of the year.
Do I need a hospital indemnity plan if I have Medicare Advantage? And what if I'm hospitalized twice in the same year?
I would 100% recommend a hospital indemnity plan. If you look at your summary of benefits, you do have a hospital copay 9 times out of 10. That could be up to $2,800 for a week if you're hospitalized 2 times in a year. Literally, if you leave the hospital and go back the next day, it's a new copay. So definitely I would recommend a hospital indemnity plan, which will pay those copays back to you. It sends the money directly to you in a check, tax-free, so that you can spend it on those needs. Those do reset after 60 days. So if you go to the hospital in January and you go back in November, it'll cover you both those times. So I definitely recommend hospital indemnity.
There's another question. What should I do if I find out that my preferred hospital or even doctor is no longer in the network with my Medicare Advantage plan?
So it depends on what time of the year it is. There might be nothing that you can do at this particular point. Again, I would reach out to an agent to see what your options are. The hospitals, they can leave in the middle of the year, and it doesn't necessarily give you an election period to change. If you're in the annual election period and at your hospital, let's say the 2025 annual election period, you saw that your doctor would be out of network for 2026, you can go ahead and speak to an agent. You can look online, see who's going to be in network with your hospital. and you can change depending on what the election period is.
Person says, I called to ask about a knee replacement and suddenly they said I need prior authorization. I thought my plan was supposed to be good. What's going on here?
Yes, so you might think that you have a good plan. Maybe it's always covered you before. Maybe you've never been sick. Maybe you've never had to use it. And maybe you had really great dental, vision, hearing. 9 times out of 10 on a Medicare Advantage plan, you are going to have to get prior authorization. They can say no. You might have to appeal it. So although you might think that it's a good plan, there's always going to be those prior authorizations with the Medicare Advantage plans.
Why are people unhappy with their Medicare Advantage plans?
I always say to every single one of my clients, people that are happy on Medicare Advantage plans are healthy. If you are unhealthy, that's when you really start to be unhappy with it. Again, prior authorizations, denials. If you really need something done, let's say you need a colonoscopy, you're scared you have colon cancer. If you have to wait 3 months to get that done, those are 3 crucial months that really could have aided in your treatment. That can be really frustrating, especially when you just want to focus on getting healthy and you're having to deal with, again, clerical work and your doctor having to go through all of that with you.
A couple of years ago, we did an interview with a man who had pancreatic cancer, and he went to get his imaging done to find out how bad it had progressed, and the imaging place said, oh, you're on a Medicare Advantage plan? It could be weeks and weeks before we get authorization to have this MRI. But then the man said, no, I'm not on a Medicare Advantage plan. I'm on a Medicare Supplement plan. They literally got him in the next day. You should look at that video. I'll link it here below.
Spitballing off of that, I think cancer plans are also a good idea. If you do have a Medicare Advantage plan and you can't either afford a supplement or you can't health qualify for a supplement due to cancer or anything else, that can give you extra money that goes directly to you. If you can't get coverage through your Medicare Advantage plan, you've got that sum of money to be able to go and get those things that you need done.
Yeah, critically important. If you're on Medicare Advantage plan, you can actually plug some of those holes. We mentioned hospital indemnity plans that can help you with the biggest cost, which is going into the hospital. But the next one, biggest one, is cancer. The exposure on Medicare Advantage plan typically leaves you paying 25% of all those costs out of your pocket until you hit your max out of pocket. And then they can even deny certain types of care, which if you did have cancer insurance, that would pay for that. And it's not very expensive at all. I have it for myself too. Can Medicare itself drop me for any reason?
Medicare cannot drop you unless you do not pay your premiums. So Part A, if you work 10 years into Social Security, I think it's 40 credits, you don't have to pay for that. For Part B, you do have to pay. Depending on your income, it could be a little bit more or a little bit less. But if you don't pay that, they can take away the Part B.
Good point. I went with Medigap because I travel a lot, but now I'm paying a fortune in premiums. Did I make a mistake?
I wouldn't say you made a mistake. I would say definitely talk to an agent. You might be paying more than what you need to for that specific plan. There might be a plan that fits your needs better. I know a lot of people are on a plan G. If you're not using it at all and you're traveling and you can't afford that plan G, there might be a plan N. There might be a high deductible G that you don't know about that might help with that financial strain, but also keep you covered and keep you on original Medicare.
In 25 years of doing this, I've realized that a lot of people think that their Medicare plan, especially Medigap plan, is to set it and forget it. You just do it one time and never think about it again. But if you think about it like your cable bill at home or your cell phone plan, they will just creep up in cost year after year. And the best thing you can possibly do to keep them in check and keep them accountable is to shop the market. And we do that for our clients all year long. You can change your supplement any time of the year. So how can I save money on my Medicare supplement? Another good question.
You can speak to an agent. If you even have a plan in and you want to stick with the plan in, if you've been on that plan for 10 years, you're going to have rate increases and those compound every single year. So there could be something that's $50 less a month for the same exact coverage. You're not going to know though unless you call and speak to someone.
How often can I change my Medicare plan?
So if you're on a supplement, you can change it any time of the year, as many times as you want. If you're on an Advantage plan, it does have to be during a valid election period. If you want to switch from Advantage to a supplement, again, it has to be during a valid election period. The 2 most popular are going to be annual election period, which is October 15th through December 7th. And then, as we mentioned earlier, Medicare Advantage open enrollment, January 1st through March 31st.
Very good. This is a very common question. How can I plan for Medicare costs if I expect to need long-term custodial care in a nursing home or assisted living facility? Does Medicare pay for that?
This is really hard because a lot of people think that they see skilled nursing facility covered in Part A. Skilled nursing facility is not a nursing home. That's going to be inpatient rehabilitation. Like after suffering a stroke, you're basically inpatient round the clock. A nursing home is not covered by Medicare, and that's really shocking for a lot of people, having to pay that completely out of pocket. We talked about this the other day. I think the average cost of a child taking care of their parent is about $120,000 for nursing home and making sure that they have round-the-clock care with their nurses and home health care. So you can get short, long-term care policies that'll help with that, but unfortunately, Medicare doesn't cover it. So you need to plan for that accordingly.
A lot of people think that when they get eligible for Medicare, it's going to take care of long-term care, and it's just not the case. But we have some solutions there. You should reach out. My friend said she got a free annual physical with Medicare, but my doctor billed me. What's going on?
So this could be one of two things. Your wellness exam is covered. However, your normal physical that you used to get before you turn 65, a lot of the things that they're going to do are not considered preventative by Medicare. The biggest example is going to be your blood draw. A lot of people, you go and get your blood drawn 2 times a year. We all do it. If it's not to diagnose something, it's not going to be covered. So that could be your bill. If you have been 2 times in a year, if you got your wellness exam done earlier in the year, that first one doesn't apply to the deductible. The second one, you might have to meet your deductible.
Very good. And let's see, what are the pros and cons of Medicare Supplement Plan G versus Medicare Supplement Plan N?
Yeah, I think that it can, either way, either plan, it can fit with a particular person. I do plan in just because, as you've probably seen, your premiums go up every year. The plan in is going to keep those costs a little bit lower for almost identical coverage. If you really break it down, you're going to get coverage on the same things. It's just with the plan in, you have those copays. If you're not going to the doctor a whole lot, it's going to save you a lot more money than the Plan G. However, for the Plan G, it could work for some people. If you go to the doctor 5, 6, 7 times a month, that could be your plan. You might have a chronic illness where you really do see the doctor that often. At that point, it might work for you.
If you're not yet subscribed to this YouTube channel, you really should, because it's a wealth of knowledge, and Hannah's going to be one of the people giving you more knowledge and more training coming up on things happening with Medicare. Thanks so much, Hannah.
Thank you.